Hello, Gary Crowley here with DoItYourselfJointPainRelief.com. This is video 4 of 5 short videos showing you how to release the 5 main culprits for running lower back pain. In video 1, we got at those hamstrings. I showed you how to get at them and with a bunch of different stretches. Video 2 showed you how to release these hips and check to make sure they're released at all the deep layers. Video 3 showed you how to release this vastus lateralis, this outer quad muscle, very hard to stretch, usually tight in people, and your IT band and this little tensor fasciae lata muscle. Now video 4, I need to show you how to release the front of your back. And for those of you who are unfamiliar with the front of your back, I'm going to show you this picture here. And basically what we're doing here is this is looking at someone from the front with all their intestines and everything moved out of the way. So this big rope of a muscle is called your psoas. There's one on each side. It's been cut away here for the anatomy picture, but there's one on each side. And then this muscle here is called your iliacus muscle. So this is the front of your back, and these are muscles just like any other muscles. So if they get tight, they can basically be yanking on these poor vertebrae that are feeding all the nerves to your lower body and causing you lower back pain. So what we're going to do is we're going to get into this psoas and this iliacus muscle with some press pull release technique, and we're going to some press hold move, and we're going to get them to make sure they're nice and released, because ideally your legs kind of hang from your psoas and your iliacus. You can see here, way up here, this psoas is attached, and it comes down and it goes all the way down, meets up with your iliacus, and hooks into the very top of your femur here. Oops. Hooks into the very top of your femur here. So ideally when you're running, you're initiating the lifting of your leg with this psoas, and then all the other stuff kicks in. If this is tight, it doesn't work as well. So not only do we want to get rid of your lower back pain, but we want to have you running more like a Kenyan out there, where you're just kind of gliding down the road. So that's what we're going to do. So that's the front of your back. And the way we're going to get at that, again, that's all this stuff right here. Your psoas runs down each side. Your iliacus is on these inside of these hips. And basically what we're going to do is we're going to have you lie on your back with your feet flat on the table. And you might have to undo your top button or so. But you're going to find those top points on your hips that we all have. Your anterior superior iliac crest, iliac spine, ASIS, and basically from right here you're going to pick a side. Let's just pick this side, and we're going to do your iliacus first, the one against that hip bone. And what I'm going to have you do is take your opposite hand and find that pointy part on the top of your hip bone and press deep in, basically come out about an inch and then go press in at about a 45-degree angle. So I'm coming out and I'm pressing at about a 45-degree angle, and I'm just going to investigate all the way down to about when I kind of run into my pubic bone. And for me anyway, and I think probably most of you, I need a little assistance with my other hand to provide the pressure. So I'm taking this other hand and I'm applying the pressure so that this hand can do basically the fine work. So I'm going like this. And then this is doing my press pull release, where I find a tender spot. Now, be gentle, but you can press in here. You can press in here, and especially if it's tender, right up against, along this inside of your ilium, your hip bone, that's a muscle. And so you can press pull release, or you can press hold move and just tuck your tailbone back and forth a little bit. In this area, I kind of like to do both. Both seem to be effective, and my brain seems to like it when I mix it up a little bit. I do that for a little bit, then I do some press pull release. See, that all just let go nicely for me. It was a little tight, not horrible. And then I'm going to come to the other side. I'm going to take my opposite hand. I'm going to find that very top point of my pelvic bone there. I'm going to come in about an inch, and then I'm going to go press in at about a 45-degree angle. And because this is an odd angle and I don't have much strength, I'm going to take my other hand and again press in, help my hand press in. And then I'm just going to press pull release, and I'm just walking down toward my pubic bone, like there's a tender spot for me. So I can press hold move, just tucking my tailbone a little bit, press pull release, And these are actually usually pretty cooperative muscles. They let go pretty well. Now, since both of those are released, I'm going to work on my psoas. Now for my psoas muscle that runs up both sides of my spine, I use the hand on the same side. So I'm going to find the top of my pubic bone. I'm going to come up, actually, find your belly button, come out about an inch, and then press in with your hands. And again, I'm pressing down at about 45, and again, I'm using this hand. So come out from your belly button, press down about an inch, press down into that tissue, and you can do a little press hold move. You can feel that psoas move when you do it. You don't want to use your abs. And then again, you can come, once you know what you're doing, you can kind of start down at your pubic bone, or, you know, back from it in that 45-degree angle. Press, hold, move. Press, pull, release. See, there's a little spot on me. Psoas likes press, hold, move a fair bit. Press, hold, move. I mean, press, pull, release works well too. And you come up, and then I do the other side. Again, for the psoas, I use the same hand as the side I'm working on. I come out an inch from my belly button, press down at about a 45-degree angle. See, this side's not as tight. My right side's tighter. And then, but when I get down toward my pubic bone, it actually gets a little tight. So I do a little press, hold, move. Come back, a little press, pull, release. And you want to be gentle here. You're pressing through some intestines. And even when you're on your psoas, you're kind of going to be pressing through a layer of intestine or two. But they squish out of the way. And when you get this done, when it's all released and there's no tender, painful spots in there anymore, you will notice your back feels so much freer and more mobile. So that is your, that's your releasing the front of your back. And again, notice how tight you were here. And notice even though you're not out running, notice how loose your back might feel. If you weren't really tight here at all, then you probably don't need to come back here later. If you were really tight here, then you know you got some work to do here. So that is video 4 or 5. And we're almost there. Hopefully you're keeping track of how tight your hamstrings were, how tight your hips were, how tight your outer quad and IT band were. Now you're going to remember how tight the front of your back was. And in video 5, we'll finally get to your lower back. So thank you for your time, and I'll see you in video 5.